Hi, my name is Lindsay Hudson, and my 5-minute videos focus on Hashimoto's disease. Hashimoto's is an autoimmune disorder in which the patient's immune system creates antibodies that then attacks the thyroid cells as if they were an illness, which then begins damaging healthy cells and leads to thyroid cell death. Hashimoto's leads to a decline in hormone production, which leaves the patient with symptoms like fatigue, cold sensitivity, dry skin, muscle aches, joint stiffness, irregular menstrual bleeding, depression, swelling of the thyroid, which is also known as a goiter, puffy face, brittle nails, and hair loss. Hashimoto's can be developed by anyone, though it is more commonly seen in middle-aged women, patients with other autoimmune disorders, individuals with a family history of Hashimoto's, pregnancy, excessive iodine intake, and radiation exposure. When beginning the examination, the NP would want to ask what symptoms the patient was experiencing. When did they begin? Did they begin suddenly or come on gradually? And does anything improve or worsen the symptoms? The NP would then want to ask what medications and supplements the patient is taking and what they are taking them for. Several medications and supplements interact with one another, which can cause some rare side effects. Some vitamins and supplements can also cause the patient to experience symptoms of Hashimoto's without having the actual disease. Knowing which medications the patient is on and when they take them could differentiate if the symptoms are due to a true illness or if they are from medication interactions. The NP would also need to ask if there's a history of thyroid disease or autoimmune diseases in the patient's family, because autoimmune diseases, especially family history of Hashimoto's, is the main risk factor of developing the disease. To begin diagnosing a patient with a potential Hashimoto's diagnosis, the NP would need to perform a detailed physical examination. The nurse practitioner should focus on the head, eyes, ears, nose, and throat, beginning with the patient's eyes to determine if the patient has preorbital puffiness that could indicate Hashimoto's disease. The patient may also complain of double vision at this time. The NP would also want to assess the patient's mouth and tongue to assess for swelling of the tongue. The NP would want to do a detailed neck examination to assess for a goiter or nodules on the thyroid. The NP would then want to perform a detailed skin and hair assessment on the patient. A patient with Hashimoto's disease is expected to have dry skin, brittle nails and hair loss. During the nurse practitioner's cardiac exam, they may notice that the patient is bradycardic with a pulse rate of less than 60 beats per minute. These assessment findings would initiate the NP to begin a workup on hypothyroidism or Hashimoto's disease. The NP would first order lab work, including a TSH, T3, and T4. TSH is a thyroid hormone that is produced by the pituitary gland. When the pituitary gland detects low thyroid hormones, it sends TSH to increase the thyroid hormone production. T4, which is also known as thyroxine, is a main thyroid hormone, which confirms that the problem is within the thyroid itself if there are low levels. T4 is responsible for the patient's metabolism, mood, and body temperature. T3 is responsible for the patient's energy, hair, skin, and nail development. The NP would want to obtain antibody testing such as thyroid peroxidase or TPO. TPO is an antibody the immune system produces that plays an important role in thyroid hormone production. Patients with Hashimoto's will have TPO antibodies in their blood due to the immune system trying to initiate thyroid hormone production. When a patient is diagnosed with Hashimoto's, the typical treatment includes levothyroxine or Synthroid. Synthroid is a synthetic hormone that works like the T4 hormone, and its goal is to restore and maintain adequate T4 hormone levels to improve symptoms of Hashimoto's disease. This treatment will be required throughout the patient's entire life. The patient should be educated on how to appropriately monitor the dosage and how to take the medication. The patient will be placed on a dosage of levothyroxine that is based on the patient's age, weight, current thyroid production, and other medical conditions that may alter the medication's effectiveness. Within 6 to 10 weeks after initiating treatment, the patient will have more blood drawn to retest the TSH, and the provider will need to adjust the dose depending on the TSH levels in the blood. Once the dosage is appropriate and keeps the TSH within normal ranges, the patient will need to have blood work done at least one time a year to continue monitoring the TSH levels to determine if the Synthroid dosage needs to be adjusted again. The patient should also be educated that certain foods and drink can affect the medication's ability to be absorbed. The patient should be instructed to take the Synthroid first thing in the morning with water before eating and drinking anything due to all the foods and drinks that affect absorption, such as grapefruit juice, soy products, iron supplements, antacids with aluminum hydroxide, caraphate, and calcium supplements. Patients should be educated on the possible life-threatening condition called myxedema coma. Myxedema coma is the result of severe hypothyroidism that has not been treated. Myxedema coma causes loss of consciousness and hypothermia, which then can lead to death if not treated immediately. Thank you.